If you are planning to have plastic surgery or you've seen a plastic surgeon for a consult, they've probably mentioned having drains. Now, this video is to alleviate your fear and teach you a little bit about your drains so it's easy for you to use them and handle them at home. This is a Jackson-Pratt drain, also known as a JP drain. We use them a ton in plastic surgery. Some surgeons use them for breast procedures. We typically don't. Tummy tucks, we absolutely do. And lipo, almost all the time we do. When we're taking either tissue, fat, or volume out of you, the body fills those empty spots with fluid. The drains are there to pull the fluid from the body while it's healing. Typically, you may have a drain for a week or longer. The drains are super easy to use, and I'm going to show you how. So this is the bulb that's going to collect the fluid. This is the drain that's going to connect to the bulb and then be inside your body. There is a little black dot. This you need to remember for later. That's on the end of the drain that indicates that a good amount of it is inside your body. At the end of it, there's little grooves that are able to pull the fluid into the drain. The bulb works on negative pressure. So it looks like this when you come out of surgery. That means it's working. As it starts to fill up with the fluid, it will open up like that and become more of a bulb. There's numbers on the side of the drain that indicates how much fluid is in the drain. What your job is at home is to monitor the drains to make sure that they're on suction and to empty the fluid as it fills up. Don't forget to record the numbers on the side with date, time, and amount, and record each drain separately. To empty the drains, you're going to make sure you have very clean hands and or gloves. Twist the top. Check the numbers on the side. Write down the amount. Dump the fluid into whatever you want to dump it into. Flush it down the toilet. When you're done with that, you're going to, away from your face, because you don't want to squirt fluid in your face, you're going to squeeze the drain. So it looks like this. Twist the top back on. And it should look like this. Again, this is how you know it's working. It's going to be suctioning at negative pressure. So sometimes you may see that the drain has lost its suction by itself and there's not a lot of fluid in there. That just means you need to place it back to suction. You don't have to empty it, but same way. You're going to open it, squeeze, and twist. Another thing you may notice is that there's not a lot of fluid in the bulb itself, but for a few hours, there's been fluid in the drain. That usually means that something's in there that may be clogging it and it's not able to make its way down. So for this, we're going to milk the drain, and I'm going to show you how to do that too. You want a dry hand and a wet hand. With the wet hand, you can use an alcohol prep pad or alcohol sanitizer on your hand. You're going to take your dry hand, and at the furthest site from the bulb, but the closest to your body, you're going to squeeze the drain. And then with your wet hand or with an alcohol prep pad, you're going to, right next to it, squeeze the drain and then pull away from your body. So this hand is going to anchor it so it doesn't fly out of your body. And this one's going to pull all the substance down. Again, move your hand a little bit down the drain, squeeze on both sides and pull, pull, and pull until it gets down into the bulb and you'll start noticing things moving through. Also, with that being said, you may see not just fluid in there, but like bits of tissue, blood clots. That's perfectly normal. Gross, but normal. The drain fluid at day 1, day 2, day 3 post-op is typically a little bit darker red. And then as your days go on with the drain, getting closer up to your follow-up appointments, it's going to turn a little orange yellowy light in color. Make sure your drain is not like dangling on the floor. That is a way to loosen the sutures that is holding the drain in place. And you may have a drain that will fall out. Again, not an emergency, but not ideal. The drain is held together, sutured on your skin. And again, with this black dot, if you start seeing this black dot coming out of your body, it means the drain is probably on its way out. The only time drains fall out is if the suture is weak, if the drain's been in for a while, if you sit on the drain and move. I've seen people knee it. Even get caught in a bathroom drawer and they've walked away. Anyways, things happen. But if you see this black dot starting to come out, you're going to want to call your plastic surgeon's office. That's our rule anyways. We want to be notified this black dot. Do not try and stuff the drain back in, only because you have normal flora bacteria on your skin. If you push that drain back in the site that's an open hole, chances are you may also push bacteria into that hole, leading to an infection. Also bringing us to infection. If you notice your drain site is red, angry, you develop a fever, there's a lot of pain, you also need to call your plastic surgeon and notify them. Keep your drains up closest to your body, not dangling on the floor. They do have these clips. You can clip them on your shirt, on your bra, on your garment if you'd like, in your pocket, on your waistband, anything. And you should be able to hide them with clothes. I actually went back to work with my drain in, which is doable as well. And I wear scrubs and they're not very baggy and no one could tell I had a drain in. The drains are just going to be a part of your plastic surgery journey, and I will be there to help you through it. I want people to not be scared about drains because they're there for a good purpose. And these are your friends for a little bit. It'll be okay. The baddie body is worth it.